am Dr. Alvin Hanna, and I'm the Medical Director for the National Emergency Medical Services for the Bahamas.
Okay, so just tell me how it's been the past few days and how things have been going.
Yes, actually I've been out here since Monday. We are at the Odyssey Airport, and we have been having multiple airlifts by chopper using the U.S. Coast Guard and other U.S. associations to bring in persons who are ill, to actually medevac them out of Abaco and Grand Bahama, which is islands that were more severely affected by Hurricane Dorian. And since arriving, once the choppers are on the ground, the patients would come into our triage area, which is right behind us, behind the ambulances. We have nurses, we have doctors, we have paramedics and EMTs, other volunteers who are assisting us. And the patients would be triaged. We determine who are the most severe, who are the walking wounded, and treating as much as we can. The emphasis is not so much on treatment as it is to decide who goes first. And once that decision is made, if we need to start, for example, give them some fluids or something to assist in resuscitating them and making them feel a little bit better, we would do that. And then they would be transported to our main hospital, which is the Princess Margaret Hospital, the accident and emergency section of the hospital, or those ones with minor issues would go to the Flamingo Gardens Clinic, which is one of our community clinics here in the Bahamas or in Nassau. We have so far, since we started, seeing about approximately 300 persons. Initially, those first couple of days, we saw quite persons who I would describe as being quite ill, some of them that really needed acute treatment. But as the days went by, we've been beginning to see more of just the walking wounded, and even persons that I would describe as walking well, who were just evacuated or being evacuated from those islands. This is a very difficult time for us here in the Bahamas. We've never experienced anything like this, and it's very difficult. The positive note I can say from my role in the medical area is that we've seen such a great outpouring of assistance from all over our partners worldwide, particularly SEDEMA have sent in persons from right away from the very beginning and have been there to support us, and we are very grateful. We are very grateful to the United States. The U.S. Coast Guards have been our partners, and they have been assisting us in evacuating. I want to say particularly we've seen here in the Bahamas, the public sector, the private sector, everybody's working together. We've even had some just public citizens who came and brought us food and water and make sure that we were okay as we continue to work. So despite this very difficult time, there is somewhat of a silver lining to it all. But this is very difficult, and it will be some time before the Bahamas really recovers from this, and we do need the assistance from our international partners, and we appreciate what is given to us.
Okay, last question. What kind of injuries have you been seeing?
Yes, we have been seeing a variety of injuries. Initially, the more acute cases were head injuries, spinal injuries. We've seen persons with pretty severe lacerations, some partial amputations of digits and limbs and so on. A lot of fractures we've seen from trauma. We've also seen some cases of persons who have chronic illnesses like hypertension, diabetes, and because they would have lost their medications in the hurricane and had to wait a few days before coming to medical attention, they would have come in a somewhat complicated state. And so we have seen persons who blood glucose or sugars were high, their blood pressures were high, and so on. We've also had a number of pregnant patients who some ready to deliver, and we've also had patients who required their dialysis, and had delay of the dialysis again because of the hurricane. So it's a vast variety of problems that we would have seen and had to deal with here.
Okay, cool. All right, well, you keep up the good work. Lastly, just spell your name so we make sure that you get it right.
My first name is spelled A-L-V-E-R-Y, that's Alvery, and my last name is Hannah, H-A-N-N-A.
Okay, thank you so much.
Okay.